So the other part that goes to that is now you've identified the patient. How difficult is the implementation of this technology?
Well, it took me a little bit to kind of find my groove in how I talk to patients about this. But once I've found the way to talk to patients about this, it literally takes less than 2 minutes. First of all, I identify the patient. And then I say, you know, I know you're using the Amsler grid and we've got you on the vitamins and whatnot, but I have a technology that may allow us to detect wet macular degeneration in your good eye. Typically, I see patients who have wet in one eye and dry in the other, at an earlier stage than what we diagnosed it in your fellow eye. And I'd like to show you that information.
Yeah. And now I'm in a situation where we're typically going to use them sooner, you know, because we're going to see the patients when they're seeing out of both eyes. And I agree. I think the story's quick. It's basically there's technology today that can help identify should this disease go to a faster progressing form. That's how I kind of explain it. And I said, and the big advantage of that is the quicker you pick up on that, the more likely you are to keep your vision or maintain it. And the further it advances by missing it, the less likely it is to return. And patients seem to get that very quickly. I tell them the same thing. It takes about 3 minutes per eye, you know, so there's not a real barrier there. I tell them to try and do it every single day, but if they're not doing it, we'll know. And I tell them it takes it out of their hands to worry about it, because if there's an alert that happens, we will know it, even if the patient may not know it, to be able to act on that and ensure that we're protecting their vision.